I'm Professor Vijay Tilak. I'm Joint Secretary of Indian Society of Hematology and Blood Transfusion. And today I'm going to talk in very brief about blood cancers. The moment you think about blood cancers, it frightens a common man because it often is associated with a death sentence which even a Supreme Court cannot undo. But now blood cancer is fully treatable provided an early diagnosis is made. For instance, there is a blood cancer which is called as chronic myeloid leukemia, CML. At one time, CML was a dreaded disease which would invariably kill the person who is having it. But with advances in therapy, we have converted a disease, a blood cancer, which was invariably fatal, to a chronic disease would necessitate taking drug on an oral basis like diabetes. So we have converted a malignant killer disease into a chronic disease like diabetes, and now further advances have resulted in a stage where we can even stop drugs provided good monitoring is there. So that is the triumph of therapy in chronic myeloid leukemia. Similarly, there was a dreaded disease in children which was called as acute lymphoblastic leukemia. Once it was a dreaded disease, it would invariably kill children. But with modern therapy, more than 95% of the children are fully treatable. And those 5% children who are not amicable to this therapy, or those among those 95% few persons who don't respond to therapy, we have now something which is called as CART therapy. And this CART therapy is something which is a blessing to those patients who are not responding to the conventional therapy, or they have relapsed. And this provides hope for all those children who have a relapsed refractory acute lymphoblastic leukemia. This therapy was previously available only in the West and the cost was in crores, but now it is already there in India and the cost is around 30 lakhs, and with more usage the cost would further fall. And similarly is the story with various other malignancies which now are either curable or we can control it and prolong the life of the human beings. My carry home message is that if some of anyone in your family or friend develops blood cancer, there is no need to panic. Go to a good center where this good hematological workup is available and get yourself a consultation and take medicines as advised. Most probably the patient would survive, would be cured, or he could be managed so that he will have a prolonged life. Thank you very much.